Hello everyone, you are once again welcome to Health Matters. Health is worth and worth is health on ABL television. I am your host Amma. Please don't forget to share, like, comment and press the notification button on YouTube, Facebook and all the other social medias. And also please don't forget to follow us or watch us live 24/7 on Freeview and IPTV on ABL television. Today, our discussion is on stroke. Stroke is a serious life-threatening condition. And when you suspect that you or someone you know or someone you are looking after is having stroke, please, as I said, it's a life-threatening condition. Call 999 and ask for ambulance because time is very essential in the treatment of stroke. So someone will ask us, what is stroke? Our brain functions well when there's a good blood supply to the brain. So when there's any cutoff or there's a temporary disruption to this blood supply, it causes stroke. Also, when the blood vessels, so the blood that flows through our brains flow through a blood vessel. So when this blood vessel at a point in time weakens, then it bursts, then you get a stroke. There are two types of stroke. When I was defining it, I explained both sides, the types of stroke. So there are two types of stroke. One is called the ischemic stroke, which is most common in all stroke cases. So the ischemic stroke is when there's a blood clot that cuts off the blood supplies to the brain, or it's temporary disrupts the blood flow because of the clots to the brain. And research has shown us that all stroke cases that we see in UK, 85% are caused by this ischemic stroke. Then we have another type of stroke case or another type of stroke, which is called the hemorrhagic stroke, which is, I was saying, the flow of blood goes through a blood vessel. So when the blood vessel weakens and then it bursts, it causes that type of stroke. But this type of stroke is not common, but is the most severe of it all. So I can't stress enough on it. When you or someone that you are looking after, you suspect that you are having a stroke, which I will give you the symptoms and all that. If you are having a stroke, please, it's a matter of urgency. It's an emergency that needs to be treated ASAP by calling ambulance 999. And immediately you call 999, ask for ambulance and just tell them stroke before you even mention your address, because sometimes now, because of technologies and all that, they can even trace you through the call that you give them. So if we know what stroke is, who is at risk of getting stroke? People over 55 years are high risk of having a stroke. But in saying that, research has shown us that 1 out of 4 stroke cases normally happens among young people. So even though I'm saying people over 55, please don't get me wrong. Don't say, okay, then if you are having symptoms that I'm going to mention, you just wait at home. Because recently, this is the main reason why I even accepted this opportunity to come and have this program on a weekly basis. Because recently, I know people close to me who are young as early 40s, even late 30s, who have been affected by stroke. So yes, I'm saying it's over 55 years, but then it can also affect people under 55 years. So let's be very careful about that. Family history as well. If a close relative of yours, if I say close relative, is your mom, it can be your grandmom, your sister, your brother. If any of those people have had stroke before, then you as a person is of a high risk of you also getting a stroke, because it means it runs in your family. Ethnicity. Most of the health conditions that I normally discuss here, it all comes to ethnicity. If you are of South Asian origin, African, Caribbean, you are also in that risk, can have stroke. But partly is because of maybe some of the health condition, because if you know high blood pressure, high cholesterol, and diabetes is commonly found in this ethnic minority. So that's why it's partly stroke is commonly found in this kind of ethnicity. Also, medical history. If you are somebody who has had a heart attack before, or if you've had a stroke before, or some people will say, oh, it's a mini stroke. Yes, mini stroke is which most of the time, if you hear, you go to the hospital GP and they say TIA is a mini stroke, that you recover within minutes or an hour. Please, when it happens that way, don't sit at home. When you experience a mini stroke, they are all stroke, and it needs a medical intervention ASAP immediately. So don't sit at home, you go to your GP. So if you are somebody who have experienced stroke before, you've had a mini stroke before, or you've had a heart attack before, please, you are also in this category at risk of having stroke. Then last but not the least, if you have diabetes, uncontrolled diabetes, you have high blood pressure, you have cholesterol, you are also in the high risk category, being likely to experience stroke in your lifetime. So all the symptoms that I've mentioned, should not be ignored. So I'm going to the risk. These are the risk factors. So once we know the risk factors, what will be the symptoms? If you are in this ethnicity, your family history of a stroke and all that, what are some of the symptoms that will determine or will alert you to say, let me call 999 to ask for ambulance, or someone that you've seen having this symptoms? So what are the symptoms that you have to be aware of? Whenever you hear stroke, always we use this acronym FAST. That is FAST, FAST. So in order not to forget, immediately you hear stroke, just let this word be at the back of your mind. FAST, FAST. So the F means face. When someone is having stroke, normally you see one side of their face drop. It drops down. Then they can't even smile. They will try to, like a normal, you smile, your cheeks are up, and other people will know that, oh, this person is smiling. But someone experiencing stroke cannot smile. And you see their mouth and their eyes just drop or bend at one side. It's a symptom of stroke. So just think about the FAST. The F is face. Drop of your face, drop of your eyes, you can't talk, you can't smile. Then we have the arms. A normal healthy person, you can lift your arms up and easily for some time without any stress. Anytime you can just drop it down easily. But someone who is having stroke cannot do that. They feel numbness, and most is the half side of their body. So they feel numbness, their arm, their legs. So that is the A. So fast, the F is the face, A is the arm. Cannot lift their both arms up and keep them up for a while. But as a healthy person, you can do it easily. So that is the arm, or they feel numbness in one side of their arm. Then speech, S in the first, speech. When someone is having stroke, you see they can't even talk well. The words that they speak, it doesn't make sense. Some cannot even talk at all. When you notice that, please, you have to act fast. Some, even as you are talking to them, they don't even understand what you are saying. No coordination, they can't even understand. Confusion, you see, like someone who is not like that, all of as you are talking to the person, they don't even understand what you are trying to tell them. They look confused. Please, 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 immediately you call 999. Then we come to the T, which is time. When I was explaining what stroke is, I told you time is very essential in the treatment of stroke. So the T means time. Immediately you notice the face dropping, speech, slur of speech, not able to talk, not able to smile, cannot lift the arm. You tell the person lift the arm, they can't lift it and hold it up. Please, you call 999 and ask for ambulance, and help will be immediately. Ambulance hears stroke, they will quickly come to wherever you are, and they will give help to either you or your loved one or whoever you were looking after. Other symptoms can be sudden loss of vision. So you are not using glasses, you can see well. All of a sudden, all these things are happening to you. You can either partially cannot see well, or totally you can't see well. It's another symptoms of stroke. Dizziness, feeling sick, and difficulty in swallowing. So you can't swallow. There's a test that when you present yourself with stroke, the doctors or wherever you go, when the ambulance comes, they will test it on you by giving you a spoonful of water to see if you can swallow it down. So if you cannot swallow, please don't associate it to be cold. Yeah, it might be flu. We are in the flu season. But if any of these symptoms are happening to you, you must act fast, as time is very essential. Then problems with your balancing, coordination. You can't stand well. You can't even, as you are standing, you can feel weakness in your body. Severe headache, migraine, severe headache, and loss of consciousness. That is the last, you will see that the person will be conscious. So when you see all those symptoms, someone that you are looking after, someone you know, please, then they will need help, and you need to call the ambulance as soon as possible as you can. So if we know what stroke is, if we know the symptoms, what causes stroke? Some of these causes, as I was explaining, I've mentioned some of them as well, but what causes stroke? High blood pressure, uncontrolled blood pressure. You have blood pressure, you've gone to your GP, they've given you medication, you are not taking the medication as directed by your GP. You are not monitoring your blood pressure. Can cause these are some of them, can cause stroke. Diabetes, uncontrolled diabetes, your sugar level, not eating the right food, not checking your sugars. High cholesterol level as well can cause stroke. Obesity, overweight, smoking, excessive intake of alcohol. Then there are some people who say, I feel sometimes I do have irregular heartbeats. You shouldn't take it for granted. You go to your doctors, you go to your GP, they will take your pulse, they will even do ECG, tracing of your heart. And if it's anything it might be a cardiac issue, that is a heart issue. If not any stroke, they'll pick it up and they will treat it. So don't ignore any irregular heartbeat. Lack of exercise. lack of exercise. There are people who don't do any form of exercise. Please, walking, I always say we have walkings, we have swimming, we have cycling. Please, let's try and exercise. And stress. These are some of the common causes that recently we've come across. People going through stress. Yes, we know there are a lot of things happening now with inflation, with people not job losses and all that. But then, yes, I know it's difficult, but too much of stress. When you are stressed, you put pressure on your brain, and your brain overworks. And when it happens, that's when you develop blood clots, which cuts off the blood supplies to your brain, or the blood vessel that is carrying the blood to your brain weakens. Then it gets burst and you end up having stroke. So let's try and reduce our stress level. When you are stressed in any circumstance, there are a lot of things. And sometimes you need to talk. When you talk to people, then you know that you are not in that situation alone. Others are also going through a similar situation, which can reduce your weight also. Some people can use, if something that you like singing, like dancing, or even going out with friends can reduce your stress level. So these are the causes. So how can we diagnose stroke? So the symptoms that I mentioned, when you present yourself with those symptoms, either in the ambulance or when you go to the hospital, there are a lot of physical tests and scans that will be done. Then that's when they will pick up to determine which type of stroke you have. If you remember, I told you we have two types of stroke. One that is caused by blood clots, and the other when the blood vessel weakens and it just get burst and you develop into stroke. So one, they will do a blood test to check your cholesterol level. If your cholesterol is high, there are some medications, statins that will be given to you to reduce your high level of cholesterol. Your sugar level, your blood diabetes. If you are diabetes, they will check your sugar level. Even if you are not, they will still check your sugar level. Some people are there who don't even know they have diabetes, so they will check your sugar level as well. And if it's high, and it might be the cause of that, then they will treat it for you as well. Blood pressure, because when I was mentioning the causes, I said cholesterol, diabetes, and blood pressure. So you have a constant monitoring of your blood pressure, and when it's high, there's also medication that they will give you to manage it. They do scans, CT scans and MRI scan, because the stroke is all about your brain. So they will give you those scans, and that will give them an accurate diagnosis of what type of stroke and what treatment to give you. Then swallow test, which I said, so the initial stage, if you are not able to swallow, they will put water on a spoon for you to swallow. If you are able to swallow, then they will now increase it to a glass of water to see where you cannot swallow. So there's a swallow test that they will administer to you as well. So if all these things are done, how can we treat stroke, or how is stroke treated? Most of the causes, most of it are managed by medication. So I mentioned earlier on statins, which if your cholesterol is high, you will be given statins to reduce your level. If your cholesterol is high, they will give you statin to reduce your cholesterol. Aspirin. Then there are some injections. So if it's caused by blood clots, if your stroke is caused by blood clot, you are giving injection to help you to stop that clot. And please, when you are giving, try, and I know injections, some people are needle phobia, but it's to help to rectify, to dissolve that clot. because until that clot is dissolved, there won't be any flow of blood to your brain. So those are the things that they can do to treat stroke. And there's an emergency procedure called thrombectomy, surgery as well. You can, depending on how severe the stroke is, you will go through surgery. Then some people, when it happens, I said you can't swallow well. Some people cannot even eat as well. So when it's that, you are given a feeding tube where they put it into your stomach through your nose to help with your nutrition. Then you be given some nutritional supplements because your body will need food to be alive. So some people, when you see them, you see that there's a tube in their nose. It's just to help them with the feed. If you are dehydrated, you'll be given fluids to keep you hydrated. If the stroke causes you lack of breathing, you are not able to breathe well, oxygen, because you need oxygen to go through your brain in order for your brain to function well. So if there's any lack of oxygen, you'll be supported giving a mask, which is through oxygen through a mask, and all these things are done in the hospital. Then if you are the other to also want to help rectify the clot to prevent DVT, they give you test stockings to wear because when it happens to you, most of the time you are not mobile, you are not able to mobilize well. So in order for you not to develop blood clots, you'll be given this test stockings to wear. So if you or somebody have developed stroke, if yourself have developed stroke or your loved one or someone you know have developed stroke, what are available? What can you do? If you've had all these treatments, what can you do? Because some people, stroke affect them differently. Some, they are able to recover as soon as possible. Others as well, it just leave them with a long-term problem. But when that happens, those with a long-term problem, the hospital, your GP would arrange a rehabilitation for you, and it involves other people, physios, psychologists, and if you think you or somebody have had stroke, have had stroke, and none of these are arranged for you, please contact your GP, your doctor. You need it. But then when you go for this rehabilitation, depending on the symptoms, depending on the severity of your stroke, their long-term plan, they sit down with you, they plan with you to go through certain things, how to be able to be independent as you were before. And most of the time, those who have been affected and their family have psychological impact. Some people, they become depressed. Others, their anxiety, they develop anxiety. Please, there are counseling programs in your GP, or even before you even come out of the hospital, they will arrange such things for you. You yourself will need counseling, and your family members who will be looking after you, because some people who have developed stroke, as I said, depending on the severity, some cannot even be mobile as they were before. They will now need to depend on people to give them personal care. That is by helping them in bathing, feeding, and sometimes it takes a toll on whoever is looking after them. So when you are offered psychological help, counseling, please take it. I know sometimes some of our people, if I say our people, some of in our community, when they psychological issues are they tell them, oh, you need psychology inputs, then they think otherwise. Oh, it's only people, those who have mental issues that need those counseling. but please, as I said, it has a toll on you and your family. So try and go for this psychological help. Others feel angry and frustration that why me? Why has this happened to me? It might not be what's your fault, but something that you have done that has caused a stroke. It might run through your family. That's why you had that stroke. Please talk to your family, talk to your friends, go for talking therapy, because a problem shared is a problem solved. Speak with your doctors, speak with your GP, speak with your specialist and nurse who will help you and support you and direct you for help, other helps that you might not even be aware of. Physiotherapists are there as well to help you with your mobility, your walking, how to get up again, to do things for yourself, have your own bath, eat by yourself, talk to them, get involved. And when I was mentioning some of the symptoms, I say sometimes you might end up having partial or blur vision. So go and have your eyes checked. And if you are looking after anyone who have had stroke, or you yourself you've had stroke, and you go for this counseling and all that, sometimes it's like you think, is it going to work? I cannot see any improvement. When you are looking after such people, please try and praise them. Every little counts. Just, you are doing well. Encourage them. Go with them. And when you do that, at least it helps them with a long way in recovery. So then how can we prevent stroke? If we know the treatment, the symptoms, and other, how can we prevent stroke? That is by making lifestyle changes. If I say lifestyle changes, what can we do? By eating healthy, eating our vegetables, eating our fruits, eating healthy, cooking the right food, exercising regularly. We have, and for us, if you are viewers of ABL, we weekly have our man who always come and give us exercise program. Once I finish, you will come on. Just those petty exercise, just do it. You don't need to go to the gym. Once you do it at home, it helps you as well. If you smoke, please seek help. You can go to NHS website, see your specialist who will help you stop smoking. Notice your drinking. If you are drinking above the limit, please reduce it. If you need help, you go to NHS website, you go to your GP, you go and they will refer you for help. You need to maintain your blood pressure, maintain your diabetes, maintain your sugar level, also your cholesterol level. You need to maintain all that, and drink loads of water. I know it's cheap. I always say it's the cheapest, product or what, but people sometimes they'll just rather go for fizzy drinks and all that. But water is less expensive. Just hydrate yourself, lots of water, and manage. Try and any condition that you have. If you've had heart attack before and all that, try and let them manage it. You yourself as well, manage it. Take control of your health. And if you are having any medication, try and go according to how you've been ordered to take those medications, so that you don't end up having those symptoms, having stroke. So in summary, what I'll say, even though it's not possible to completely prevent strokes in happening, but at least there are some things that we can do, which I've mentioned in our lifestyle changes. So if you think you yourself or anyone that is around you or you are looking after is having a stroke, please get medical advice. And if you are looking after anyone who has stroke, make time for yourself. Sometimes it can be daunting, but don't try and ignore your well-being and your mental health well-being as well. Try and make time for yourself. You can meet with friends, meet with families, and even go out for a walk, take a fresh air, and when you come back, you will not feel that burden that person who you are looking after is giving you, like you is being that's a burden on you. Try and look after your well-being, and also ask for help. Without you asking for help, there are a lot of help out there. If there's equipment that you need, they can help you with it. So try and contact your doctor, the specialist nurse as well, and they will help you with that. And speak out. Speak out. We need to talk. Socialize. As I mentioned before, problem shared is a problem solved. Try and speak out. Ask for help, and you get it. So please don't forget to call 999 and ask for the ambulance when you are experiencing any stroke symptoms, or anyone you know is experiencing stroke symptoms, and ask for help. Ask for help. So thank you so much for watching Health Matters. Health is worth, and worth is health, and we will meet next week. Thank you.